thing that you want to ask. Equally, you can just tell us something you think is important, that you want us to think about. One of the things that Wes and I do is to, after events like this, to think through what people have said to us. And so take your opportunity, because there is going to be an election, obviously, 5 weeks on Thursday. I'm not going to give a great lecture about that election. That's not what you came here for. But there's a choice. It is going to be a clear choice at this election between carrying on with what we've had for the last 14 years, which, to my mind, is chaos and division and failure. And I include the NHS in that, and it breaks my heart, frankly, as the party that set up the NHS, with so many of my family members having contributed to the NHS. To leave the NHS in a worse state than when you found it, for me, is unforgivable in politics, whichever political party you are. That should never, ever happen. And we will absolutely take this challenge up if we are privileged enough to come into power. But it is a choice between carrying on with more of that, 5 more years of this, or saying we've had enough of the chaos and division. As a country, we want to turn the page, and we want to start the job of rebuilding our country, which, of course, is centrally focused on our economy and our health as a nation, which is where, if we do come into power, we hope to be working with you on this. Now, the final thing I'll say about the sort of government that we would want to be if we are elected in, it's a government of service. I think too many politicians these days have become a bit too self-entitled, a bit too fond of the sound of their own voice, and forgotten that actually politics is about public service. It's a form of what you are going to go into, what you're training for, a public service. You're there to serve people, to serve communities, to serve the country. And that's why we want your questions and ideas. This isn't a kind offer from us because we're here. You've actually got the right to ask me and to ask Wes any question. Because if we're going to be a government of service, then it is you and other communities that we are here to serve. And therefore, this isn't a kind offer, it's actually your right. You're entitled to ask us directly on the spot anything that you want, or to tell us your view. So on that, we will try and get through just as many as we can. If our answers become too long, stick your hand up and we'll move on so that we can just get as many of you in as possible. And I'll try to keep remembering that we've got people all around us. So I think we've got one to start, and then we'll literally go to wherever the next hand is.
So Ali, who is a third-year paramedic student, is breaking the ice with the first question, and then it's over to you.
So Ali, your third year, is it 3 years in total?
Yeah. So due to qualify in the next... Oh, got a mic. Due to qualify in the next 2 months or so.
Fantastic.
Yeah. But firstly, I'd just like to thank you for being here. Normally, as students, we're overlooked. So you being present with us today is appreciated by all of us.
Well, it's our privilege to be here.
Within the manifesto, it states, the Labour manifesto states to reduce hospital wait times, but it doesn't elaborate on how it's going to be done. Can you bring some light to that, please?
Yes, I can. I'll just say the sort of headlines, and then Wes is obviously doing a lot of work on this and will be responsible for dealing with the problem you all know about, which is nearly 8 million on the waiting list. This is shocking, by the way. It's never been that high. And certainly in the hospital where my wife works, it's bearing down on the staff, because every day they're concerned about the fact that they, in a sense, can't get on with the day job because the backlog is so high. So we've got to do something about it. And this will be a first step, so one of the first things that we do, and not the only thing that we do for the NHS, but just the first thing, which is to have 40,000 extra appointments and operations every week. So that means using operating theatres in the evenings, on the weekends, so 40,000. We'll pay for that by getting rid of the non-dom status completely. That's the special tax status for the super rich. That means they don't pay their tax in this country. I think if you live here, you should be paying your tax here, so we'll get rid of that. We also want to get in the money that isn't being paid in tax by those that are avoiding it. That 40,000 each and every week amounts to 2 million a year, so it's a big chunk out of the waiting list. We will be working with NHS staff, so we're not going to do it to the staff. We're already talking to the staff. They'll obviously have to be paid, and paid properly for doing it. There is a version of this going on in some hospitals already. So in St Thomas's, one of our London hospitals, The hospital itself has set it up because they just want to get through their backlog. Leeds Hospital that Wes and I went to doing the same thing. So I've been working with the NHS to get those waiting lists down. And what I would also say is this. The last Labour government said it would get waiting lists down and did it. We got the waiting list down to the lowest level and the satisfaction in the NHS to the highest level ever. The fact that satisfaction in the NHS is at the lowest level ever now is shocking. It's soul-destroying, and you must feel this, that the government has put the NHS in a position where the people that you will be serving and caring for have less faith and confidence now than they've ever had. We've got to turn that around. So we've done it before, we'll do it again, whereas you'll be leading on this.
Yeah, and what's amazing about what they did at Guy's and St Thomas's is they managed in a single day to do the same number of procedures they would normally be doing across a week. So we know this works, and one of the great things, you know, in my experience of going around a whole range of hospitals around the country, including with Keir, is that often you meet people who are really burnt out, stressed out, and really feeling that moral injury because of the state of care for patients and feeling powerless to do anything about it. And yet what I saw at the hospital, I can literally see from my office window in Westminster, what we saw in Leeds was real professional pride, because these were services designed and led by clinicians, which is what gives us the confidence to know it can be done. And alongside doubling the number of CT and MRI scanners, and not just more scanners, but AI-enabled scanners, we can also get right into the 1.6 million people who are waiting with anxiety for diagnostic tests and scans. And that gives us the confidence to be able to say to you and to the country that by the end of the first term of a Labour government, we can restore NHS waiting time standards to 18 weeks, so no one is having to wait to the extent they are today.
So if you've explained that St Thomas Hospital has done their working week in one day, don't you think that would lead to staff burnout and overworking of staff?
Yeah, so the crucial thing is that no one is going to be forced to do these shifts, because we recognise the pressure on people's workloads. And also I think one of the things the NHS needs to improve on as an employer is recognise what's going on with people outside work as well, particularly in terms of caring responsibilities, flexible working. So we're going to do a whole load of stuff in that area as well. But what I've been bowled over by is that people have come forward to do these shifts, not just because they appreciate the extra overtime pay, which they will get and are getting, but also because they can see the results for their patients. And this isn't locums, these aren't agency workers, these are core staff who are opting to do it. So if people are able to do it and want to do it, we'll deliver it. And to be able to work in an improving NHS, I think will do so much for staff morale and retention.
So the teams in St Thomas in Leeds, we met the team there, they were organising themselves. So they'd done it and they'd volunteered to come and do the extra time because they could see the effect it was having on their patients, and that was driving them. So what we'll do is we'll take the hospitals that are doing it and use those teams from there, sort of almost crack teams, to go around to other areas, say this is how we did it, so this is the sort of most effective way of doing it. But thank you for that. Where should we go next for a question? Yes?
I've got a question about universal credit and being a student. I'm a mum of 4, but I've only got 2 living with me. And it's clear universal credit does not work with the student loan at all. I'm struggling, I'm barely making ends meet, can't work because I'm out on placement. What would your team or the Labour Party do to actually help that, because there isn't any actual help there at the moment?
Yeah, I think one of the problems is that universal credit, when it was rolled out, wasn't rolled out in a particularly good way, and therefore there's been lots of problems along the way in terms of how it works, but also how it interacts with other benefits and support. We may need to make sure the thing is joined up so that one doesn't sort of work against the other. So we will be looking at universal credit to try and make it work better for you. What do you think would make the most difference from your own point of view? Obviously, you've got 2 children at home with you.
Yeah, me personally, when I first started doing it years ago, it was bursaried. Like, there was no student loans, so it didn't affect anything. In fact, student nurses were a lot better off when it was bursaried. Now we're getting into debt to do a job for the country.
Yeah, I mean, I feel so strongly about this. This is one of the first debates I led in Parliament as a brand new MP in 2015 when we were first elected. And my frustration about things like scrapping the NHS bursary is it's so much easier to scrap things than it is to replace them. And I want to do more for people like you, and particularly those nursing, midwifery, allied health professionals, especially where we're recruiting people in as mature students later in life. I think that's really important. On that, I'm just going to ask you to bear with us, because one of the things we're working so hard to do, as well as to make sure we can rebuild our country, is to rebuild trust in politics and politicians. So we're not making any promises at this election unless we can be 100% sure that the promises we make are promises we can keep and the country can afford. We will, of course, try and over-deliver, but I'd rather under-promise than over-deliver than do the opposite and make promises now and then come back in 4 or 5 years' time and say, I'm really sorry, we'll let you down.
Can you just give your example just to my team, so we've got the particular details of yours? I'll come to this side, and then I'll come to that side. Yes?
So you mentioned burnout earlier. Thank you. For paramedics now, it's heading towards like 3 years, which is what our training is. So I just wondered how you plan on retaining health professionals in the NHS. And what kind of things you have in process for keeping us working in the NHS?
I think the burnout thing is really important in the NHS, because what's happened, certainly where my wife works, is that there was a huge amount of pressure during COVID on the NHS, as you know. And as soon as the staff came out of COVID, they went into a terrible situation with a backlog. Now, that backlog was there for a long time. I think the 18-week waiting list timing has not been hit since 2016. And so we need to lift the workforce up. There are things you can do straight away, like respect and dignity of the workforce. And I don't know what you feel, but if I were you, and certainly working in the NHS, and I had the Prime Minister simply blaming the NHS for the problems, rather than taking responsibility as a Prime Minister, it would go a long way. Because you can't sort of clap our carers and our key workers during the pandemic and then turn around when you're challenged, as the Prime Minister does on the NHS, and say it's not my fault, it's the NHS staff. That is really disrespectful. So that needs to be in place. We need to take the pressure down, which is where the waiting list comes down, because it's very difficult to feel uplifted in your job if you know there's a waiting list that's getting bigger and bigger, because it's worrying, it takes all the time and energy. So that will help as well. And then working on staff retention so that we can have those staff retained. I think there's one more thing, and to bring Wes in on this. We haven't had the next generation of staff coming into the NHS quickly enough. So we need that. There are plans now in place for the next generation of staff to come through. I mean, you'll be part of that. But one of the problems we've had with the NHS is, of course, it takes time to train people. So politicians say, well, we won't do that. We won't put enough emphasis there. We'll just do other sticking plaster fixes. They don't work. You've got to do the hard yards of training the next generation to come through. But I want, to put you in a position, if we are privileged to form a government, where you not only feel really proud of what you are doing, as you will, but where we drive up those satisfaction levels, because the public are so appreciative of the NHS. For the government to have taken it to this place where the satisfaction levels are so low is really, really shocking. Wes, did you want to say anything on that?
Yeah, I mean particularly for you guys who are paramedics, I think making sure that you're not spending an entire shift sat in the back of an ambulance with the same patients waiting for a handover. There are things that can be done to reform the handover process at the back door of the hospital. That requires easing a bit of pressure in A&E, and our plans to train up thousands more GPs to cut through the red tape that ties up GP appointments mean that people will be able to get a GP appointment. Better for them, because you can see a GP when you need one. Also better for you, because A&E isn't full. Also better for the taxpayer, because a GP appointment costs about 40 quid for the NHS to provide. Because they're not available, someone ends up in A&E, which costs £400. So it's the worst of all worlds, where patients get a bad service, you have a miserable experience as the staff, and we're not spending the money that goes into the NHS as well as we might be able to. And that's why we're trying to get that balance right between the investment that the NHS needs, but also the reform and making sure the money that goes in is well driven. And the final appeal I'd make to all of you, even as students, we recently launched an initiative based on something they do in Singapore called Get Rid of Stupid Stuff. And this is where frontline staff working in the NHS can tell us things that you encounter in your everyday working lives where you think, This is not making my life easier as a member of staff. This is not going to help my patients. Why are we doing this? You tell us, we'll do our best to solve it, because we're going to have to work with and learn from you on the front line to make sure that you're working as happily and effectively as possible and patients are getting the best possible care. But we can only do that by having these conversations and learning from you, because you're the ones who are seeing it on the front line.
Just two fun things about paramedics. We've got a very good friend as a paramedic, lives around the corner from us, and he told me what it feels like to be sitting in his ambulance, this is when it was really bad, not being able to discharge the patient that he's got, and you hear over the radio the call, a 999 call, particularly for a heart attack, and you can't move your ambulance. And for him, that stripped the heart out of what he was doing, because the reason he was doing it is because he wanted to be in the ambulance going towards whatever the problem was, and he was sitting, waiting, but he could hear the call coming over the radio. And the other, on Saturday, I think it was, I was in Stafford with a paramedic, a woman who said to me that it used to be that the paramedics waited for the 999 calls to come. Now the 999 calls have to wait for the paramedics to come, and the way she put it was just heartbreaking. So we need to turn that around. Let's come to this side of the... Yes, please.
Labour have committed to implementing the Cass report, which has been widely criticised by multiple LGBT plus organisations in full. Why should the LGBT plus community vote for Labour?
Wes, I think you've led on this.
Yeah, very much so. Look, I think if implemented properly, the Cass review can improve healthcare for trans people, particularly trans young people, who are waiting far too long on waiting lists. When they are presenting for care, they're not receiving the holistic care that they need. And as a result, we're seeing people, especially when you look at the numbers of on mental ill health, self-harm, attempted suicide. I think effective treatment in this area can be the difference between not just being life-changing, but life-saving. And I understand why there's a lot of fear in the LGBT community, particularly the trans community, because the backdrop against which the Cass report landed of a really quite toxic and ugly political conversation that has made trans people feel unsafe and not included and disrespected. And it's our job to fix both of those things, the toxic political culture, but also to make sure that young people in particular get access to high quality, well-evidenced care and holistic care, and that when they reach the end of the childhood and adolescent service, that they're not just pushed off a cliff into an adult service where they feel that suddenly all that support has then disappeared. If we get this right, and if we implement the Cass review in the way that Hilary Cass has intended, I think this could be transformational actually for trans people. But I do understand why there's a lot of fear and anxiety, and it's our job to fix both of those issues, and I hope we're given the chance to do that.
I think there's a wider piece here which is really important, which is, in my very strong view, over the last 10 years or more, politics have become much too divided and toxic. And you've had a government that's trying to find the differences and to divide people, instead of a government that actually tries to bring people together and to respect across differences. I think that's a really important change that we have to bring about, because the politics of division, where you're simply saying, instead of saying, what do Wes and I share, saying, where are we different, if you do that across the population, then you strip away something that's really important about community and about being the country that we are. Let's come to this side. Yes, sir. Do you want to get the microphone, because we've got a camera running and you can't be heard?
Thanks for the opportunity. I would like to find out what your government will be doing to support nurses, general nurses, when they come out from school, because already there might be accumulated of debt ahead of them. And in so doing, I also like to find out what your government also will be doing to support nurses traveling abroad to seek greener pastures, because they are not enjoying the services in this country. Thank you.
Well, we need to support our nurses, and that's obviously what we're talking about here this morning. Thank them for what they're doing. Make sure the environment is one in which people can want to stay here in our NHS and work in our NHS and are properly supported and feel properly valued. So that's what we want to do. It goes back to the question of retention, I think, of staff, because the burnout and the number of people leaving is a very big problem for us. So that is essential to what we need to do. Where's on nurses?
Yeah, I agree, and I'm worried about not just the retention challenge, and obviously we're seeing national strikes in the NHS for the first time in history. For me, the even bigger risk isn't that people walk out on another day of strike action, but they walk out of the NHS altogether, and we can't afford to lose you. So we will work constructively with you, the workforce, to do as much as we can, as fast as we can, on the things that really matter to you in terms of your working pay and conditions. It is going to take time, and I'm asking people to judge us on our record as well. You know, when we were last in government, we came in 1997. Actually, the pledges were really small. We promised to cut NHS waiting lists by just 100,000 by sacking some NHS managers. So before your managers have a mild heart attack, that's not the pledge this time around. In fact, we've gone even further in terms of what we're pledging to do. But we were asked about this question of pay. Well, can you do pay restoration? And we said, as we're saying today, we're not going to make promises unless we're 100% sure we can keep them. But you know that as the last Labour government did deliver full pay restoration. We did get waiting lists down to the lowest ever, and we got patient satisfaction to the highest ever level. So we got a strong record. And against this backdrop of cynicism about politics and politicians, can it make a difference? Can it be a force for change? Give change a chance on the 4th of July and turn to the party that founded the NHS, that has the best record on the NHS, because we, the people in this room, and I'm really looking at you now, not just the politicians here, we could be part of the generation that might be able to look back on our time, either working for the NHS or serving in government, and be able to say that we were the generation that took the NHS from the worst crisis in its history to getting it back on its feet and making it fit for the future and being genuinely proud. I know that's a far cry from where we are today, but I genuinely think we can do it with your support and with our collective efforts working together.
I think it's so important in terms of retention and morale. We want you to join a workforce which, as Wes says, in 5 years' time, all of us, but you in particular, can proudly look back and say, we're the generation of incoming staff at a time when the NHS is back on the rise, is back able to cope, where people are feeling much better about the NHS. That'll be a feeling of incredible pride for you, and it's for us to create the conditions in which that could happen. Just before I leave it, is there anything on your mind that I can be thinking about on my way home?
All right. I think possibly the student, because by the time they come out of school, they're already in debt. So if a student decides to work with the NHS for, let's say, about 5 years, then all the debt have to be.
Okay. So it's the debt issue.
Here.
Right, brilliant, thank you. Let's go to this side.
We've got some behind us.
These are difficult to do because let's go here.
Thank you. So for me, my understanding is the government always roll out funds towards health service innovations, but then these things are being debated in the parliament from a political perspective. So my question is, how is your party intending to involve students and healthcare professionals in those debates so that when you are rolling out funds, they are specifically for things that we really need towards patient safety and our safety as well?
That's such a good question, and let me deal with it in two parts. Firstly, we do want to roll out more technology. Radiologists working with AI can pick up cancer so much more quickly and more accurately than working on their own. So there's huge benefits to it. And our ambition is not simply to get the NHS back on its feet, which it is, but it's also to make sure that the NHS is fit for the future. We very proudly look back on the last 70+ years from when Labour founded the NHS. Every year we have a sort of celebration of another year of the NHS. That is good, but our job is to do effectively the same as was done after the Second World War. It's just to make sure the NHS is fit for the next 70 years, not just celebrate the last 70 years. On your point, though, which is really good, when I used to run the Crown Prosecution Service, and I had 7,000 staff, so less than, obviously, the NHS staff, and they were in about 100 offices across England and Wales. And what I used to do was I went to every office, and I would have the first session of the day would be with junior staff, and I'd say to them, without any managers there, what's the biggest headache? What's the thing that's going wrong? that I need to know about? Because you can read a paper sitting in headquarters about this. I mean, in our case, it was all about files and digital files and the use of digital technology in criminal justice. So what's actually going wrong on the ground? You tell me what your headache is. And then the next question after that is, what's your workaround? Because the staff on the ground knew the best way to deal with the problem, because they were dealing with it every day. And some of the best ideas we had came actually from the staff saying to me, look, Keir, this idea in relation to digital files is all very well, but it gets stuck in this bit of the system. And what we've done to do it is to do this with the file, and it was fantastic. We need to do the same with you and others, which is, yes, we want to use technology, yes, we want to drive this forward, but we need to talk to people on the front line about what works best, what makes a real difference, because your everyday experience, and everybody who works in the NHS, is actually the most important evidence of what is possible. That's such a good question. Thank you so much. Let's go to this side. I've got one at the back, and I know you've been waiting ages, so I will come. Just, if you don't mind coming forward just a little bit so we can get the sound as well.
So health inequalities in this country is quite severe at the moment, especially within the homeless population. I was just wondering on what you would be currently willing to do to support homeless people back into supportable housing, removing poverty, that kind of thing, because the statistics are rising at the moment.
The homelessness issue at the moment is terrible, and it's got a lot worse, and we have to tackle it. Where we've got Labour mayors in place, we're beginning to do that. So Andy Burnham is obviously the mayor in Greater Manchester, and he said, I'm going to make this a priority to provide the support that people need. And quite often that isn't just a roof over a head, but it is a roof over a head. It's also the other support that goes with it, particularly on things like mental health. And we've got a big pledge to increase mental health in the community. But I think, you know, again, it's one of those things under the last Labour government, we were able to bring homelessness right down. It is shocking that it's back worse than it was. And just human things. You know, I've got two kids, a 15-year-old and a 13-year-old. And for them, it's not unusual to see someone sleeping on the street. Yeah. The fact that they've grown up thinking that this is part of how Britain is a really terrible place for us to have got to, because they've not known a time when that wasn't the case. So we have to do it. I think we build on what has been done by Andy Burnham and other people, because, you know, where something works, we should do more of it. I'm going to go straight on, because you've been waiting, I think, all the way through, and I'm not meaning to ignore you.
Some notes as we've been going, actually.
Oh, okay.
So it was sort of a combination of the first two questions. So at the moment, there's like no incentive for mature students to come in and train in the NHS, particularly for midwives like we are. There's a lot of negativity at the moment about maternity services, so that's an added pressure. A few years ago, I think the statistic was something like every 30 midwives that qualify, you'll lose 29. So actually, you're only gaining one midwife, which is actually crazy.
Well, because just 29 fall away along the
yeah, because they just
route.
leave the profession because it's too much. And also, what are your opinions about making, it's probably beyond your remit and a lot of investment, but blanket policies for all hospitals. We're a three counties hospital, university, and when we go back into university, we're always finding, oh, well, my hospital does it this way, my hospital does it this way, and actually, surely that affects outcomes as well.
Yeah, Wes.
That's a lot, I know.
I know this is something.
Yeah, no, I'm really glad you asked, because there are so many what I call kind of burning deck issues in the NHS at the moment, like those things that are really urgent and pressing. And one of the things that I'm awake at night thinking about is the state of maternity services and the impact that's having on mothers, babies, and the staff in the service who are leaving in numbers which are frankly terrifying. And part of it is about recruitment and recruiting more midwives, and we've got a commitment to do that and a plan to deliver that. But then there's, to your point, about patient safety and the way in which services are designed and the extent to which you're listened to as staff. And Donna Ockenden, you may know, has done a big review of maternity services in Nottingham following the scandal there. So many of the lessons apply nationally. I think we've got to make sure that we get the balance right between allowing frontline staff to try new things and to innovate and to work with, you know, the environment you're in and the conditions and the hand that you're dealt with. Also make sure we've got clear national standards and there isn't this postcode lottery, and that women don't fear going to one hospital on the day because when they've called the ambulance to pick them up, they find the hospital they were expecting to go to is full. This is going, or indeed closed.
Yeah.
And this is going to take time, and it's why we can't afford to lose midwives. And this, for me, is a sort of day one priority of making sure that we're learning the lessons of Donna Ockenden, that we're applying them as quickly as possible, and giving you guys the confidence that things will improve so that you don't feel that it's just not worth it and you want to go do something else. Because some of the worst conversations I've had with people recently are with midwives who are heartbroken because they're no longer midwives, and I don't want any of you to be in that position.
We can't give the care that we want to. We have 2 lives at risk, much like any other profession, but there could be 3, there could be 4 lives at risk. And I speak to some people, especially me coming from like a hospitality background, I could just go back to hospitality and go and earn more than I would be making as a midwife.
No, absolutely on it. And keep talking to Wes about it. We've only got time for one more question, so I'm just going to do the only bit of the room I don't think we've done adequately. Let's take both questions and we'll answer them jointly. So here and then here. Keep it nice and short, and we'll try to give short answers.
Hi, thank you. My question is more about speaking from being an international student, and I'll be qualifying soon because I'm my 3rd year now, and I'll be an international nurse. I just want to ask, is there any, because coming in as an international student, I know like the home students, they have the universal credits which they get the NHS bursary. Due to our visa, we're not allowed certain public funds and support. But as healthcare students and healthcare workers, I think there should be some sort of financial support in place to support international student nurses or healthcare students, and when we eventually qualify.
Brilliant. Okay, thank you so much for that. We'll come to that. I'm just going to take both.
Oh, it's just got...
Oh, sorry. Let's do. If you ask as well, and we'll try and do both because we're slightly running out of time. But at least we get. You're deciding what that's.
As a first-year physician associate student, I would just like to get your perspective on how you see the future of the physician associate profession within the NHS. Well,
it's a very important part of what we do, and it needs to be supported as part of our overarching plans for the NHS. I mean, we've set out today in particular the first steps, which is the 40,000 off the waiting list, but that's a first step towards a rebuild of the NHS across the board. And that's really important that you get a sense of our ambition here, which is not, as I say, just to make sure the NHS is running year on year better than it is now. We desperately, desperately need that to happen, but also to lift it up and make sure it's absolutely fit for the future. Wes, over to you, and also do you want to pick up the international students?
I want to reassure all the physician associates here. There is absolutely a role for you in the NHS, and a valuable role, and I've seen physician associates playing that role. I know there's some anxiety about the substitution of doctors with physician associates, and I think that's a legitimate concern doctors have, and we've got to deal with that concern because I can see the growing toxicity and how that's spilling out into the workplace. So for your benefit and for theirs, I think we've got to knock that on the head, take the concerns seriously and address them. And to the final point, I want to say 2 things to you as an international student. We'll certainly take away what you've said to us and reflect on what you've said. Firstly, thank you for being here and for the contribution that international students make to our higher education system and the contribution you've made to our NHS as a generation for over 75 years now. It's an enormous contribution. I really appreciate that. We've also got to make sure that we don't continue to over-rely on people from overseas, and that we also make sure we train our own homegrown talent, because I think particularly for students we recruit from red list countries where there are severe healthcare shortages, we've got to make sure that we're not recruiting from countries that desperately need their own healthcare workers. But I'm proud of the fact that the NHS is and always has been an international employer, and that people like yourself have chosen to come to the UK and commit yourself to the health and care of others. And I really hope that you have a really rewarding career, and I'm really glad to see you here today.
Can I just, we've run out of time, can I just say a number of things? Firstly, thank you so much for being here. Thank you for asking us questions and putting your point of view. If you did want to put a question, or you think of something later in the day that you'd like to have asked us, we will make our team available so you can send them through by email or whatever convenient way. And we, Wes and I, will do our level best to make sure we get answers to you. So don't think this is the only opportunity. If there are other things, maybe you had your hand up, maybe you didn't, maybe you, later on this afternoon think, I wish I'd asked this, then please make sure that we get those questions or your points of view, send them through to us, and we will deal with them as a team, because we want to give you the broadest possible opportunity to hear what we've got to say and to put your views across. Thank you so much for being here. Thank you for what you've chosen to do with your lives and with your careers. I genuinely hope that we can get this election over the line, and that we can come back and talk to you again, where we're not just talking about what we would do if we were in government, but where we can say to you, we are now in government, let's continue the conversation, because your fingerprints should be on what we do next. And so I look forward to that. Thank you so much for your time. Thank you for being here.
Thank you very much.
I think I'm going to do media.